You are staring at the seventh patient chart of the morning, same age bracket, same familiar symptoms, and, well, the exact same standard prescription.
Yeah, exactly.
You walk into the clinic room, and before the patient even opens their mouth, your brain has basically already finished the appointment.
It is incredibly common, honestly. Your clinical skills are firing perfectly, but your conscious mind is, just playing a pre-recorded tape.
Right. And for you listening today, especially the hardworking doctors, nurses, and medical staff across Malaysia, that feeling is, well, it is more than just fatigue.
Oh, absolutely.
Mm-hmm.
It is what happens when the sheer volume of cases just causes the wards and the diagnoses to completely blur together.
Exactly. So today our mission for this deep dive is to explore how to combat that robotic detachment. And we are using insights from Dr. Fang Cheng Carr's book, Jom Mindful Gym Now. And just to note, the correct pronunciation for that first word is Jom. So it is Jom Mindful Gym Now.
Which is a fantastic resource, by the way, because the reality is this detachment, it actually starts out as a natural survival mechanism.
It's a survival mechanism, really.
Yeah, think about it. When you are constantly managing a massive cognitive load, like dozens of patients, complex decisions, heavy stress, your brain relies on habituation just to save energy.
Oh, so it just groups similar things together to cope.
Right, exactly. But the trap there is that your genuine compassion slowly hardens into this mechanical routine.
Yeah, your empathy basically just goes on standby.
It really does.
So to bring that humanity back to the clinic, Dr. Fang introduces a concept he calls the Auld Lang Syne Effect. And this draws from the Japanese philosophy of ichigo ichi, meaning, well, one time, one meeting.
And calling it the Auld Lang Syne Effect is honestly so fitting. Just like that, that classic song we sing at the end of the year.
Right, the one that reminds us of the fleeting nature of time and old friends.
Yes. This concept asks us to view every routine encounter as precious and temporary. It is a realization that this specific conversation with this specific patient will just never happen exactly this way again.
Okay, wait, I have to pause you there and maybe play devil's advocate for a second.
Sure, go ahead.
Realistically, how does that not drain your energy even faster?
That is a very fair question.
Because if a medical officer on, say, hour 10 of a grueling shift has to treat all 40 of their daily patients like some profound, fleeting, once-in-a-lifetime encounter, I mean, they are going to completely crash by noon.
Oh, 100%. If you approach this by trying to manufacture heavy emotional significance for every single interaction, you absolutely will crash.
Right. Nobody has the emotional bandwidth for that on a busy ward.
Exactly. But the Auld Lang Syne Effect is not about generating more emotion. It is a cognitive strategy. It is basically a pattern interrupt.
A pattern interrupt, like breaking muscle memory.
Yeah, precisely that. Think of your clinical routine like deep muscle memory.
Yeah.
When you rely solely on it, your expertise kind of becomes frozen.
Because you stop actively listening.
Yes, because your brain assumes it already knows the ending based on the last 100 cases you saw.
Ah, I see what you mean.
So, Ichigo Ichi acts as a circuit breaker for that autopilot. By simply reminding yourself, this exact moment is unrepeatable, you force your brain out of its energy-saving default mode.
And that brings you back into the present moment.
Exactly.
So instead of dragging the mental fatigue of the previous 100 similar cases into the room with you, you are just dealing with the one unique human being sitting right in front of you.
And that actually drops a ton of the baggage.
It really does.
It is a beautiful irony, honestly. We know that long service in healthcare naturally leads to that robotic habituation. I mean, it is an occupational hazard.
Yeah, a very common one for anyone in a hospital setting.
But using the Auld Lang Syne Effect to recognize the impermanence of a single moment actually cuts through that exhaustion.
Which is how your medical expertise remains fresh and responsive, rather than rigid and frozen.
Exactly.
You are treating the person in the present, not just matching a pattern from the past.
So to summarize the main takeaways here for everyone listening, first, long service naturally leads to robotic detachment. Second, the Auld Lang Syne Effect breaks this cycle by highlighting that a moment is completely unrepeatable. And third, this practice keeps your medical expertise fresh instead of frozen.
That makes a lot of sense. So here is our challenge, our call to action for you for your next clinic shift.
We really want you to try this.
Yes, try applying this Auld Lang Syne lens to just one single routine task or ordinary conversation. Just one. Notice how it changes the quality of your attention when you recognize it will never happen again.
And as you try that, leave some room for this final thought.
What is that?
Well, If we accept that every single patient encounter is truly fleeting and unrepeatable, how might embracing that impermanence actually be the very thing that protects you from burnout?
Wow, that is a really powerful way to look at it.
Right. It might just restore your own joy and healing.
Because when you stop fast-forwarding to the end of the shift, you might just rediscover why you started this journey in the first place.